Implementing value-based care can help providers improve patient health and reduce care costs. But in order to meet the specific performance metrics required in this model, providers must find ways to emphasize clinical efficiency and improved health outcomes. Specific care management and wellness programs can be a solution in addressing this. And one example is a popular program overseen by Medicare, Chronic Care Management, or CCM. In this video, we'll cover 3 areas where a CCM program can help your practice implement and transition to value-based care, so you'll have a better sense of how exactly CCM can set you up for value-based care success. Hi, this is Dan from ThoroughCare. At ThoroughCare, we've streamlined value-based care for clinics and physician practices all across the United States. The shift to value-based care ties provider compensation to specific performance metrics in order to drive change. For example, private insurers and Medicare now use alternative payment models, such as MIPS, to promote value-based care. In these arrangements, providers could miss reimbursement and revenue opportunities if they fail to meet or exceed metrics. So how can chronic care management help your practice implement and transition to this model? We're going to discuss how a CCM program can help your practice address specific performance areas that are relevant to value-based care. These include patient satisfaction and engagement, patient health, and clinical efficiency. If you'd like to learn more about how CCM works and how billing codes work before watching this video, you can watch and learn more about these right here. But for now, let's dive in. The first way CCM can enable value-based care is by improving patient satisfaction and engagement. Value-based care emphasizes creating a satisfying patient experience. It aims to provide a more transparent, valuable exchange in a world where most everyone finds healthcare complicated and costly. Patient engagement is important to value-based care because it can influence health outcomes, especially when it comes to preventive care. Whether that involves diet and exercise or disease and screening, an engaged patient is more likely to participate in these preventive measures. CCM is a way to help your practice encourage this behavior. CCM can improve access to a patient's primary care team and strengthen their continuity of care. How does it do this? Many of the program's services naturally address these benefits. When your patient enrolls in CCM, they are agreeing to monthly interactions with your care team or care manager. This increased level of engagement automatically expands access to clinical staff, which can improve the flow of information your patient receives. CCM can also reduce the number of office visits a patient may need to make, which can save them time and make their life easier. This can go a long way towards offering greater transparency, which can boost patient satisfaction. The second way CCM can enable value-based care success is by enabling better patient health. Chronic conditions can play a detrimental role in a patient's life and can lead to a more serious health issue, such as a heart attack, if not managed correctly. By improving patient engagement and strengthening continuity of care, CCM can enable focused preventive health and lead to fewer hospitalizations and emergency room visits. Monthly check-ins, along with a personalized care plan, can help your patient follow recommended therapies or interventions. This is far more effective than the traditional sporadic office visit and can help enable better health. Continuous observation and management of chronic conditions, especially when your patient has multiple chronic conditions, can also help to track any changes in their severity. This can give you greater insights as to the impact these conditions have on your patient's overall well-being, all while helping to inform care decisions. A CCM program can also work with additional care management programs, such as behavioral health, to provide more comprehensive treatments. This can support greater clinical efficiency through integrated, coordinated care, and it can help further personalize your patient's experience. And lastly, the third way CCM can enable value-based care success is by maximizing clinical efficiency. With CCM, your practice can engage and treat a high volume of patients remotely. With monthly engagement occurring via phone or telehealth platforms, your practice can regularly support a continuum of care. This closes gaps in services and treatment without relying on office visits. More importantly, non-complex CCM does not require provider time. Your staff or care manager can perform nearly all of the tasks associated for CCM, while the provider comes in at the end and reviews everything. On average, a care manager may be able to engage 100 to 250 patients per month. Software solutions can further streamline this process. Task automation, scheduling tools, and health data integration can increase your practice's capacity and help reduce your staff's workload. It's also possible to outsource your CCM program. In such arrangements, you can collaborate with an outside service provider that can fully manage your program. This allows you to offer further services and clinical access to your patients without committing additional staff or resources. CCM reimbursements can help your practice establish a new source of revenue. This can help expand capacity in other areas or support the adoption of new technology to further increase efficiency. So, as you can see, CCM can help your practice meet the performance metrics underlying value-based care, including patient engagement, the effectiveness of treatment, and clinical efficiency. The program can also help your practice with reimbursements that can drive additional revenue. The program really is a win-win for your patients and your practice. If you'd like to learn more about CCM and value-based care, visit our Learning Center. There's links in the description below. Or if you're interested in how care coordination software can help you implement a CCM program and transition to value-based care, then contact us at the link below. If you found this video helpful, please like it, add a comment, or subscribe to this channel. Thank you for watching. Goodbye.